Hi everyone, here's your data update. As of June 2nd, 52% of Chicagoans have received a first dose of vaccine. This is up 4% over the last 2 weeks. 63.4% of Chicagoans 18 plus and 70.7% of Chicagoans 65 plus have received a first dose of vaccine. 1.4 million Chicagoans have received at least one dose, and now over 1.1 million have completed their series. Compared to the rest of the state and the country, Chicago's mostly keeping up with every other age group in terms of first dose coverage on the left, but still far behind for 65 plus, with 70.7% coverage compared to 86% nationally. For completed series on the right, similarly, we're keeping pace with the younger age groups, but far behind for 65 plus at 61.8% completed series compared to 75% nationally. On the left here, you can see Chicago's 7-day rolling average of first doses in blue, completed series in green, and total doses in black. Our current 7-day rolling average is 8,068 doses, which is nearly half of what it was 2 weeks ago, and that's compared to 31,000 at the peak in mid-April. Our first doses in blue have started to decline again, though we're hoping that interest picks up after the Memorial Day weekend. On the right, you can see the 7-day rolling average is nearing where we were on January 20th, when we had very limited supply. This is to be expected, but also unfortunate for our teens who still need vaccination to stay safe. Here you see the sharp increase in the blue line on the left, and that's the 7-day rolling average of first doses for our 12 to 15-year-olds. But after that, you also see a sharp decrease in the 7-day rolling average soon after. Completed series on the right by age will tell us whether teens are going back for their second doses, but we're going to have to stay tuned. Some people are saying that with the city opening back up, why do we care about vaccinating teens anymore? Well, they're still getting sick. And when I was rounding at the hospital at the beginning of May, I saw some of them. Here are the new teen COVID cases by zip code. The locations where the cases are opposite to where the early surge of teen vaccination was. This concerns me. An MMWR out just today shows us that adolescent hospitalization rates increased from March to April. 1 in 3 required an ICU admission, and 5% required mechanical ventilation. The vaccine protects against serious illness and allows kids to safely enjoy summer activities, which they desperately need for their mental health. We can't let them down just because we're exhausted. Once you start talking to them, it's clear that they've been waiting for this, but they can't do it alone. In terms of facility types, it appears we're seeing declines across the board, likely due to lower demand. But our outpatient offices need to step in here to get back to basics and reduce missed opportunities as more families schedule their well child care. Hospitals can also pitch in to reduce missed opportunities by vaccinating upon discharge from the emergency room or hospital. Assess their vaccination status at triage, in the patient's medical history, and during med reconciliation by asking the patient and also linking with the eye care registry in the emergency department. We've done this before for hepatitis A, and it's worked really well. Strongly encourage and offer vaccination to all eligible patients and any friends or family who are there with them. Consider using a pharmacist assigned to the facility to help with medication management. They can be a great champion for a project like this. They can support you confirming vaccination status before vaccination and just encourage the workflow in the department. Utilize personnel not involved in the direct care of the patient, if available, to administer vaccines if the ED is very busy, and it would help with the workflow. You could even consider a flagging system outside the room for patients who've consented, so that someone else can vaccinate them while they're waiting for you. Urgent cares also have opportunities to vaccinate their patients at sick visits. So let's all pitch in and try it. The zip codes with the darker blue have the highest percentage of missing doses. We're starting to see some evidence that particular variants may require a second dose for full protection. So that's a reminder for us to get those recall reports moving and be aggressive and tag onto city incentives. For example, the White House announced yesterday that June will be a national month of action to mobilize Americans to get vaccinated in a sprint up until July 4th. They revealed multiple business incentives that you can leverage to get patients into your office. So go ahead and promote these. Go to vaccines.gov/incentives to find a list, and you can talk about it with your patients. Also consider having your clinic staff volunteer to do community canvassing and door-to-door education. They can be vaccine ambassadors, and it may help to lift morale. Everyone needs to feel like we're nearing the end of this and getting out and seeing people again. If they need some training, remember to send them to the City College's website, ccc.edu/vaccineambassador, to brush up. You could think about joining them too. It makes a big difference to people to see their healthcare providers in their communities and on their block. You and your clinic staff should be proud of the work that you've done to get us this far. As a pediatrician, though, I have to beg you to not leave kids behind. They may be the last to be approved for vaccine, but there are a lot of families out there who still need our help. Have a great week.